Alrighty, class. Now we go into the axial skeleton. This is going to be great. Hopefully you'll learn a lot. Here's a nice little radiograph. And here's some fun facts. So let's see. The adult human body has 206 of them, 26 bones in the human foot. The human hand, including the wrist, contains 54 bones. The femur or thigh bone is the strongest and longest bone of the human skeleton. The stapes in the middle ear is the smallest and lightest bone of the human skeleton. Arms are among the most commonly broken bones, accounting for almost half of all adults' broken bones. The collarbone is the most commonly broken bone among children. I know some of you have broken your collarbone. Bones stop growing in length during puberty. Usually most epiphyseal plates will close around 18 and your spine will continue to grow until about 25. Now bone density and strength will change over the course of life, however. The only bone in the human body that's not connected to another is the hyoid. It's almost a V/U-shaped bone located at the base of your tongue. Bones are made up of calcium, phosphorus, sodium, and other minerals, as well as the protein collagen. And bones function as the skeleton of the human body, allow body parts to move, and protect organs from impact damage. They also produce red and white blood cells. So we covered some of the physiology of it from last class, but now we actually go on to what the actual axial bones are. So here's our overview. The axial skeleton itself includes the skull, the vertebral column, and the thoracic cage. The appendicular is the upper limbs and pectoral girdle, lower limbs, and pelvic girdle. So that's the appendicular, and this is the axial. So we'll talk about the axial today. There's another look at it. Real quick overview, 206 bones in the adult. They form the framework. The axial skeleton, central axis of body, skull, vertebral column, and thoracic cage, 80 bones. Appendicular skeleton, appendages, shoulder, hip, and bones, and those of the lower and upper extremities make up 126 bones. The axial skeleton, the skull has 22 skull associated bones. There's 7, so total in the skull will be 29. The vertebral column has 26 bones. Thoracic cage has 25, so you have 24 ribs plus a sternum. And the vertebral column is 7 cervical, 12 thoracic, 5 lumbar. So 7 plus 12 is 19, plus 5 is 24. Then you have a fused sacrum and a coccyx, which makes it 26 for a total of 80 bones. There's roughly about 270 bones at birth, but some fuse as we age. There's some bones that are sesamoid bones. They form within tendons due to stress. There's even wormian bones, which are extra bones embedded in the skull, but not everybody has these. So before you start studying the axial skeleton, you want to know or study the different terminology that we use to pretty much describe bones or features that are found in bones. And if you don't have a good understanding of these features, then studying the axial skeleton and the appendicular skeleton are going to be very difficult. So what is a canal? Canal is a tubular passage or bone or tunnel in a bone, like the auditory canal of the skull. A condyle is a rounded knob, occipital condyles of the skull. You have a crest. That's a narrow ridge, iliac crest of the pelvis. Then you have an epicondyle, which is a flare superior to a condyle, medial condyle of the femur. Facet is a smooth joint surface that is flat or only slightly concave or convex. You have a fissure, which is a kind of a slit through a bone. You have orbital fissures or behind the eye, which allow for blood vessels and nerves to pass through. You have a foramen, and the biggest one is the foramen magnum, a hole through a bone. It's usually round. So again, the foramen magnum is of the skull. The spinal cord will go through there. A fossa is a shallow, broad, or elongated basin. So you have the infraspinatus and the supraspinatus fossa. You also have a subscapular fossa. Linea or a line is a raised longitudinal ridge. You have nuchal lines, but you have a linea aspera in your femur. Meatus is a canal. So knowing that a canal and a meatus are relatively the same thing, then you want to make sure that you're looking for some kind of tunnel or passage. Process, any bony prominence, mastoid process of the skull. Protuberance, a bony outgrowth or protruding part. A sinus, a cavity within a bone. Spine, a sharp, slender, or narrow process. Sulcus, a groove for a tendon, nerve, or blood vessel. Tubercle, a small rounded process, greater tubercle of the humerus. And tuberosity is a rough surface, so tibiotuberosity. All right, so now looking at the lines, the meatus, the process, the condyle, the spine. If you look at this image, you see a crest, you see a sinus, you see a foramen, which is an opening, you have an alveolus. Again, just looking at these, you have a fossa, another trochanter, crest, head. Okay, so make sure you know this terminology when you're studying. Let's look at the skull itself. 22 bones joined by sutures, several cavities, cranial cavity, orbits, nasal cavity, oral cavity, ear cavities, paranasal cavities. Foramina are holes where nerves and blood vessels pass. So when you see a foramina or a foramen, you're going to see some kind of blood vessel or nerve go through it. Here's the skull. Here's the lateral view, frontal bone, parietal bone, temporal bone, zygomatic bone, mandible. And then you have a cranial fossa. So the bones of the brain case around and protect the brain, which occupies the cranial cavity. The base of the brain case, which forms the floor of the cranial cavity, is subdivided into the shallow anterior cranial fossa, the middle cranial fossa, and the deep posterior cranial fossa. So again, if you look at the bones, you got the parietal bones here. You have sagittal suture. Suture, as you know, you might associate that with stitches, like you suture something. Well, the sagittal suture keeps the two parietal bones together. You have a lambdoidal suture, which connects the parietal bone and the occipital bone. You also have a frontal or a coronal suture in the front, which will connect the frontal and the parietal bones. And then you have the temporal bone here. And then you have a squamosal suture right there that will connect parietal and temporal bones. Okay. Sutures, here we go. The coronal is found between the frontal and parietal bone. Lambdoidal suture found between the occipital and parietals. You have the sagittal suture that's found between the parietal bones, and then the squamous or the squamosal is found between the temporal bones and the parietal bones. Okay. So if you look at this picture, here's the cranial bones. If you see the frontal bone, parietal bone, here's those wormian sutural bones that you find in some of the sutures. Not everybody has these. Here's the occipital bone, temporal bone. Here's the sphenoid bone and the ethmoid bone here. Okay. Now remember, you have one frontal, one occipital, one sphenoid, one ethmoid, but you have two parietal bones and two temporal bones. Here's a front view, and definitely you want to know this view here. Here's the frontal bone. Here's the glabella, which is right in between your eyes and above your nose. Here's the coronal suture. Okay. Parietal bone. Ethmoid bone. Sphenoid bone. Zygomatic bone. Okay, the vomer bone. So you do have to, I know it seems intimidating at first, but you do have to memorize this stuff. And whatever's on this image here is fair game. Okay. Now, cranial bones enclose the brain. You have the frontal. You have a coronal suture and frontal sinus found in the frontal bone. You have two parietal bones. What are you going to find there? Sagittal suture, coronal suture, lambdoidal suture, squamous suture. You have one sphenoid, one ethmoid. Temporal bone, you have a squamous suture. And there you find four regions. You have the squamous, tympanic, mastoid, and the petrous part of the temporal bone. And then the occipital bone, you have lambdoidal suture, foramen magnum, and the occipital condyles. Here's the skull again, so showing you different images here. Here's the inferior view. Okay. Here is the frontal bone, coronal suture, parietal bone, sagittal suture, parietal foramen, lambdoidal suture, occipital bone. Here's somebody, if they were to cut their face off here, you would see basically the frontal bone, you'd see the brain, you see the sinuses, the nasal cavity, the maxillary sinus, the nasal septum, maxima, and the mandible. Again, all these words shouldn't be too foreign for you. You should have heard these before, but now it's time to memorize them. Here's the paraspinal sinuses. So when you say, oh, my sinuses are clogged, well, you can have a frontal sinus and a maxillary sinus, and pus can get filled in there, and you get inflammation as well. So now, here's the foramina of the skull and the nerves and blood vessels that are transmitted through them. So knowing which bones and then knowing which go through them are important. So if you look at the frontal bone, you have a supraorbital foramen or notch. Well, what's going to go through there? Well, the supraorbital nerve, artery, and vein, and an ophthalmic nerve. You have a temporal bone. You have the carotid canal, external acoustic meatus, jugular foramen. Okay, the carotid canal, you're going to get the internal carotid artery. You've heard of that before. External acoustic meatus, you get sound waves to the eardrum. You have the jugular foramen, you have internal jugular vein, glossopharyngeal, vagus, and accessory nerves. Occipital bone, you have the foramen magnum, hypoglossal canal, spinal cord, accessory nerve, vertebral arteries, hypoglossal nerve to the muscle. So going back and knowing what bone it is, what little foramen is found in there, and what structure goes through there would be a good way to study this. Knowing where the optic canal is and what goes through there, the optic nerve. Some of these are super easy, but some of these can be difficult. You look at the maxilla and the mandible. So mandible is your jaw, maxilla is above, right? So you have an inferior orbital fissure, you have an infraorbital fissure there, foramen, and knowing what goes through there. So some of this is unfortunately just pure memorization that you have to do. Okay, again, the cranial fossa. What sits in the cranial fossa? In the anterior cranial fossa, you have the frontal lobe. In the middle cranial fossa, you have the temporal lobe. In the posterior cranial fossa, you have the cerebellum. So it makes a nice little shelf for your brain to sit in. All right, if you look at the right temporal bone, you've got a lot of things going on. The squamous suture, squamous part, zygomatic process, mandibular fossa, external acoustic meatus. You got the mastoid process, styloid process. So it gets, again, a lot of things are going on, but you do definitely have to know all this. Again, a different view, the parietal bone. I'll give you a list of all the things that I want you to know for sure, so then you can work off that list on the axial and the appendicular skeleton. So then you can make a checklist of all the things that you need to know instead of just saying, oh, know everything. All right. Lateral wall of the nasal cavity, superior nasal cavity, middle nasal concha, and I'll give you a study guide as well. Sphenoidal sinus. Here's a zoomed up version of the frontal bone, supraorbital margin, sphenoid bone, optic canal, zygomatic bone, the maxilla, nasal bone, lacrimal bone, ethmoid bone. Now here's one of my favorite cranial bones. It's called the sphenoid bone. A lot of people haven't heard of it, but it sits posteriorly to the ethmoid bone. A lot of ligamentous attachment, a lot of blood vessels and nerves pass through this. It's got a greater and a lesser wing, kind of a moth or butterfly shape. You've got sphenoid sinuses, and then you've got the sella turcica. And the sella turcica is interesting because your pituitary gland sits right in this little pocket. So any damage or issues with the sella turcica can damage the endocrine system, which is involved with the pituitary gland. So a lot of things, you see how the human body is interconnected. Now if you look at this picture here, you look at Gary Busey. If you know who Gary Busey is, pretty famous actor. But anyways, he had a severe car accident. And one of the fractures that he sustained was actually a sphenoid fracture and ethmoid. And if you can see just from that fracture how it's really shifted his face, see his eyes a little squinty, his ears a little more protruded on this side, eyeball sticks out more, and his jaw is his whole face is kind of contorted to one side. And that's due to the sphenoid bone. So if you have issues with the sphenoid bone, you can get facial asymmetries that occur in your face. So if you see one nostril that's bigger than the other, you have this facial asymmetry. If you want to look at the perfect facial asymmetry, we look at our man Denzel Washington. This guy's almost perfect. His eyebrows are symmetrical, eyes, nose, the zygomatic processes, his nose, his mandible, and his maxilla are perfectly in line. So Denzel Washington, if you look at his symmetry, is pretty much perfect. Brad Pitt is another one that has perfect symmetry, right? So you can see that some of the most famous actors in Hollywood have very good symmetry. He's famous, but he's famous for other reasons. He usually plays the villain, so villains need this kind of look. But he's still a good actor. Ethmoid bone, that's found anterior to the sphenoid, right behind your nose. You have the ethmoidal sinus. You have the crista galli. Okay, you have cribriform plate, and in this cribriform plate, you get a whole bunch of olfactory nerves, and they're used for sense of smell. So one of the telltale signs that you can know if the ethmoid bone is injured is if a patient comes in and say, "Hey, I can't smell." I know that that's one of the signs of COVID, but they don't have fractured ethmoid. This is after a trauma, if they've hit their nose on the steering wheel or they've fallen. So if you look at the sagittal view here, you can look at a pretty intricate design. You got the superior, middle, and inferior nasal conchas, the nasal cartilages. You've got the sphenoid bone here. Okay, and what these nasal conchae do is they warm and humidify the air. Okay, so if they trap large particles, they warm the air. It's very simple. All right, here's the ethmoid bone. Here's the nasal bones, the frontal, parietal. Here's again the glabella, so here's another view of it. Here's the inferior nasal concha, inferolateral wall, nasal cavity, create turbulence in inhaled air and separate the bone here. So again, they're creating turbulence so it warms and humidifies the air here. Now, you probably heard of a deviated septum, right? So if you look at this gentleman's nose, you see how his right nose nostril is not as open as his left, or you can really see it on this gentleman, right? So they can do surgery. You see the little incision that they made here where they fix their nasal septum right here. Now, how else can you get a deviated septum, or can you get someone to eat away at your inferior nasal concha? Well, there you go. Don't snort cocaine. All right. So definitely don't do that. And then here is probably more skin cancer, but some of it is related to cocaine use as well, because very relatively young to have skin cancer at this, so they had to probably take this out. But this is why you don't do drugs, right? I've always said don't do drugs, don't do dumb things. But here's a good graphic image of why you don't do that. All right. And here's that vomer bone that with drug use will pretty much get eaten away or it can disintegrate. Okay. Now the palatine bones, they form the posterior third of your hard palate. So like if you get a brain freeze, you go to 7-Eleven and get a little Slurpee, you get a brain freeze. If you actually put your tongue on the roof of your mouth, it'll help with that. So try that next time.